Welcome to True Health Tuesdays, and the truth will set you free. Okay, today, and this is like hot off the press, so I was trying to do the latest research, and I've got some data here. We've got new numbers on what your blood pressure should be today. I'm not going to reveal it right now because it's really important that you get this. You've got to know what your physiology is supposed to be. Does that sound psychotic and stupid and ignorant to anybody but me? Okay, so let's look at high blood pressure. Okay, how many people have checked the blood pressure of their fish? Dog, cat, squirrel, ferret? Okay, no, let's look at this. Your body is self-healing and self-regulating. Okay, that's fact. Every animal species on the planet regulates their own physiology. So is high blood pressure the silent killer, like what the ignorant medical doctors are telling you? And I gotta say it that way because is high blood pressure really a silent killer, or is it an adaptive physiologic response based on physical, chemical, or emotional stress? What if there's nothing wrong with your body when you develop high blood pressure? What if high blood pressure is really keeping you alive? And what if the therapies that we're doing, because your body is self-healing and self-regulating, except when the doctor says it's not? Okay? What if the interventions are causing you harm? Well, we know cardiovascular disease, we're talking one of the leading causes of global death, and it's rising. Okay, 17.3 million deaths per year. By 2030, it's going to go up to 23 million. Now this is death of from cardiovascular disease of our species, our species. So what's wrong? Like if I put that 1 in 3 water buffalo are going to have heart disease, would you think that there's something wrong with the herd? Or would you just think that they're a defective species? Okay, what's normal? Typically, and this is what's ingrained, okay, is 120/80. What's the normal blood pressure mean? Now we have an entire video series on what the numbers actually are, like what a sphygmomanometer is, who developed it, okay, how it started back in 1905, Dr. Kartkov, okay, we have all of that data there. But when you ask the average person, what's the normal blood pressure? What are they teaching now in school, Doc? 120/80, okay, good. And so this was the guide. However, where did this come from? It turns out that there's a joint national committee, and we're currently in Joint National Committee 8, but that's been usurped by a couple of other organizations. But Joint National Committee 6 in 1997, there's a group of medical professionals, people that run hospitals, pharmacy reps, and they decided out of this book that your blood pressure optimally should be 120/80. Hypertension was 140/90. That was the decision. Now this lasted till 2004. Now this means every man, woman, and child, every 300-pound man, every 100-pound woman should have the same blood pressure, 120/80. And if their blood pressure was different, okay, that's it, then we're going to give you a chemical to lower it or to get it down to what we feel is correct. That went good until 2004. Then Joint National Committee 7 met again. And they decided, no, 120/80 wasn't appropriate. It needed to be 115/75. In fact, 120/80 was pre-hypertension in 2004. And so that means every man, woman, and child, no matter what your body type, no matter what your activity level, everybody, okay, is going to have 115/75. And if you're 120/80, you were at risk. Now, what happened in 2014? Joint National Committee 8 met, okay, and they have a new, and when you read the article and the data behind it, we have a new science-based guidelines. Now you might think, well, wasn't Joint National Committee 6 science-based? Wasn't Joint National Committee 7 science-based? Wasn't Joint National Committee 8? But it's a new relaxed-based guidelines, and they actually said if you're over 60, your new normal is 150/90. If you're under 60, it's 140/90. So get this, okay, everybody, man, woman, and child, doesn't matter age, height, activity level, anything. Okay, in 1997 it was 120/80. Group of people get together, that's Joint National Committee 6. Joint National Committee 7 in 2004, they said no, it's 115/75. Everybody's going to be the same. That lasted till 2014. Then 2014, Joint National Committee 8 met and decided that every man, woman, and child should have, if you're over 60, 150/90. If it's going to be higher, we're going to give you a chemical to alter your physiology because we know your body is self-healing and self-regulating, except when it's not. Any arrogance there? Any arrogance thinking that your body is not really self-regulating? Okay. Well, we have new guidelines, came out 14 hours ago. Turns out that the American Heart Association and the American College of Cardiology, now they don't go along with the Joint National Committee of 8 because it turns out, I'm just thinking this. Okay, the phone call of the guy that got the diuretic beta blocker, ACE inhibitor, and calcium channel blocker, all of which can do damage to the heart, and I'll show you the data on it. They got this in 2005, so here it is, 2017. Bob! Yeah, there's your doctor. Yeah, it turns out that we have different guidelines now. Yeah, you shouldn't have gotten that diuretic or beta blocker. Oh, you got cardiac arrhythmias from that. Oh, okay. Well, you can stop it now. We got new guidelines. Yeah, it turns out your body is self-regulating. And since you're over 60, 150/90 is a new guideline. How's that conversation going to go? But don't worry, American College Cardiology and American Heart Association, now they say 130/80 is normal. So let's go over the psychosis. Now, how should blood pressure measurements be taken? These are the guidelines of Joint National Committee 8. I'm not sure the guidelines of the group that's just now came up with their new number. Measurement should be taken with the arm supported at the level of the heart and not till the patient has been sitting for at least 5 minutes. If an elevation is found, the blood pressure should be taken 5 minutes after the person's been laying down. And then immediately upon standing and 2 minutes later to rule out postural effects. See, when you go from laying to standing up, the body has to actually elevate the blood pressure to withstand that pressure or the distance from gravity. Is this ever done? Okay, 2/3 of Americans are overweight, and it turns out that if you use a normal cuff on somebody's arm who's overweight, you're going to get an incorrect reading. Also, if you talk to a patient during blood pressure, it can raise it 50%. How many people are saying, gee, Bob, how's your day been going? Pretty good, man. You know, I just wanted to get my doctor visit. Turns out pseudo hypertension, okay, like it's all going to be normal. We got white coat hypertension. We've got pseudo hypertension. So now every adult in here, we got the same arm? Yeah, you never seen the inside of a gym, have you? Okay. His arm is the size of a normal human leg. Okay, so you know, obviously, and we're talking 20 years ago, my mom, who had very, very sensitive arms, she was getting her blood pressure taken, and every time it tightened up, she would just, you know, like wince in pain. And I said, do you think this pain might be elevating it? Well, yeah, maybe. Could you put it on her leg? So he takes the cuff off her arm and puts it around her leg. And I said, her leg's a bit bigger than her arm. Don't you think that maybe you should have a different size cuff for that? Oh, okay. It's mind-boggling. The time of the day can change blood pressure, the temperature of the room, a full bladder, eating or drinking, sitting, standing, supine, how you slept the night before. Do you understand? Okay, and it's supposed to be taken at 3 different occasions at 3 different times of the day over a 2-week span in that 5-minute supine laying down. It's mind-boggling. Let's look at a massive amount of common sense, okay, which is very, very rare now. Okay, Harrison's medical textbook. The first principle of hypertension is knowing when to treat it and when not to. If you go on to this medical textbook, it actually has wisdom. It talks about if a woman has tolerated diastolic of 120 for 10 years, why do you need to lower it? Okay, and it looks at the body is always going to be adapting to the environment. So let's say that you go through, I don't know what guideline you're going to follow, Joint National Committee 6, 7, 8, or the new one that people are breaking free, okay? And they're deciding their own idea. Let's see what you're going to do. So you've gone to the medical system. They said, yes, you have blood pressure of, I don't know, whatever, okay? So we're going to give you calcium channel blockers, beta blockers, ACE inhibitors, diuretics, and of course, since you have high blood pressure, cholesterol drugs are very commonly prescribed. Calcium channel blockers, according to the American Journal of Cardiology, they could increase your risk of heart failure. Why? What is broken? Think of this, okay? You've been diagnosed with high blood pressure. Is anything broken? Your body has said you need an elevation in blood pressure to adapt to this physiologic environment. Your body is self-healing and self-regulating. This is what all doctors learn, self-healing and self-regulating, except when the number doesn't form to the book. Okay, so calcium channel blockers are dangerous, beta blockers, ACE inhibitors. It turns out that if you slow the heart down, if you decrease the pressure, you're decreasing oxygen and nutrients to the tissue. So this is going to increase cancer rates, it increases heart disease, increases diabetes. And patients, I'm getting there's such a fear factor instead of a respect factor for how intelligent your body is. And I'll tell people, okay, so you're taking a blood pressure drug. Do you think that helps oxygen in the brain or slows it down? You know what people will say? I don't know, I'm not a doctor. Okay, let me word it differently. You have a drug slowing the heart down. Does this help oxygen or slow it down? Still, if they say, I don't understand it, I say, I can't accept you as a patient, I'm sorry. It ain't gonna work. Let's look in the Mr. Fit trial. Now they screened over 350,000 people. They came up with 13,000 people that were gonna be hypertensive. Now, they decided on 140/90. That was gonna be their goal. They were gonna treat all these people with diuretics and they were gonna get their blood pressure down, and they did it. They did it. They got this group of people down to 140/90. However, the bummer, the diuretic group that was treated actually had the highest death rate. And they think it's probably from ventricular fibrillation due to potassium depletion. But they did reach the goal. Now, here's a bummer, okay, and this is out of May 2015, the University of Alabama. It turns out that scientists figured that your risk of stroke went up for 1/3 of each blood pressure medication taken. And then if you're on 3 or more blood pressure medications, that your risk of stroke was much worse than if you had totally uncontrolled hypertension. What do they call blood pressure? What's the line? Oh my God, you got to take this. It's the silent killer. Your risk of stroke goes up if you have high blood pressure. Really? Really? What about the article that says if I take a chemical to lower it, that your arrogance, that you're smarter than my body, that my risk of stroke increases? Let's look at how the body actually works. The body is self-healing, self-regulating. If you have clogged arteries, if you have a toxic deficient lifestyle, your artery used to be this big, it's now this big. Okay, do you think to get the same volume that your body and its intelligence and its wisdom would actually have to elevate the pressure in order to get the same nutrients through? Of course. So it doesn't cause a stroke. It's actually an adaptive physiologic response to a toxic deficient lifestyle. You're in as much trouble by the time you are on 3 medications that achieved excellent control. You have excellent control, but your risk of stroke increased 248%. As when your hypertension is untreated, which is amazing. Why? Because the doctors are not taught that your body is intelligent. It's amazing because your blood pressure reads great on this machine. However, you're going to be really sick. We want to raise the issue that despite great advances in the pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. Let's look at the Archives of Internal Medicine, and this is randomized controlled trials on statin or cholesterol drugs. Now you might say, what's the function of cholesterol? And honestly, there's such a programming of the population, they'll say, well, it clogs arteries. Really? Well, it's the precursor to every hormone you make. In fact, your adrenal glands produce every glucocorticosteroid, mineralocorticosteroid, and sex hormone out of this building product called cholesterol. 70% of your brain's cholesterol. The surrounding membrane of every cell in your body is cholesterol. Okay, nearly every cell in your body. And here it turns out that 11 randomized controlled trials, 65,000 participants, did not find the evidence for the benefit of statin therapy on death. It didn't help. How about statins stimulate hardening of the arteries or atherosclerosis and heart failure? Thus, the epidemic of heart failure and atherosclerosis that plagues the modern world may be paradoxically be aggravated by the pervasive use of statin drugs. We propose that the current statin treatment guidelines be critically reevaluated. Oh, the statin treatment guidelines. That's different than the blood pressure guidelines. That's made up by people that aren't respecting that your body is self-healing and self-regulating, that perhaps you need more cholesterol. And in fact, when you look at cholesterol, there is no good cholesterol or bad cholesterol. There's cholesterol, a low-density lipoprotein carrier that carries it to the site of injury, and you need cholesterol in order to produce hormones, or if you have an inflammatory process going on, it produces cortisol. Cortisol is the greatest stress hormone ever. And so what if we start looking at this, that the body's intelligent? It might be a good idea. The Journal of Metabolism, Clinical and Experimental, it turns out that cholesterol drugs, beta blockers, diuretics, okay, even anti-inflammatories, can cause permanent changes in your genetic expression. And there's a big difference between genetic and genetic expression. And so this means that heart disease, cancer, diabetes are the end result, or could be the end result, of giving these chemicals that, because we're smarter than the body. Consequences for modern medicine are profound, since it would imply that our current understanding of pharmacology is an oversimplification. Boy, is that the understatement of the week. Have you ever heard of a doctor saying, dude, that diuretic really worked. You're better. Thank goodness you took that cholesterol drug there for 5 years. You are so much healthier now. No. Okay, so what's the short-term effect of slowing oxygen down to the tissue? Decreased circulation, oxygen deficit, and fatigue. If you're curious about this, read the side effects or the effects of the blood pressure drugs. Long-term, heart muscle degeneration, okay, enlargement, degeneration of any organ. So you're going to see on these drugs, and it says it on the package insert, kidney damage, liver damage, stomach damage, lung congestion. Lucian Leap. The medical field, the third leading cause of death behind heart disease and cancer. And this is fact. This is a medical system that's not based on patient outcomes. It's not saying, look, man, your body's smart. You've got these stress signs. I love the Journal of the American Medical Association. This is what we need to start doing. We need to start bringing common sense back in this world. Many current practices that seem logical but are without evidence may be reconsidered and incorporated into a less dogmatic and more patient-centered approach to care. Patient-centered. Does that mean that if you're prescribed a diuretic, a beta blocker, or an ACE inhibitor, that they follow you up? And not by looking at your blood pressure, but looking at your lifestyle. How are you sleeping? How are you eating? What's your disease rates like? Do you now develop type 2 diabetes because you're in more of a stress state because we're drugging you? Dr. Paul Roche, the blood pressure, it's simply an elevated blood pressure reading on some measuring device. It can have a number of different causes, but they're not taught critical thinking in the medical world. Not if you're following a book. It's got to be rethought. And again, Journal of the American Medical Association, 48,000 patients with heart failure. So these are patients with damaged pumps, okay? Now they found out that if they had a higher systolic, higher than 161, so this is way higher than any Joint National Committee 6, 7, 8, or the new stuff they're making up, okay? Way higher than that they had lower death rates. So could this, now think about this critical thinking. What if somebody with damage to the heart muscle required higher blood pressure to survive? What if the body in its wisdom decided to raise the blood pressure so it can keep damaged tissue healthy? Oh my gosh, when you look at this, at the video we did on stroke, they actually can artificially elevate blood pressure up to 200 systolic in order to keep the brain alive after a stroke. And this is common. Let's have a new paradigm. Let's think about normal. Okay, your body is healthy in its natural state. Your body is self-healing and self-regulating. Anybody got a problem with that? Because if so, I'm going to take you out in a parking lot and hit you. I got a ruler from a Catholic person here, and it says all the 10 Commandments. I was beat on the back of a wrist when I was a kid. Your body regulates itself. That means that it goes up and down. And when I'm explaining this to patients, you got to walk people through to where they're at. Okay, do you want to take blood pressure when you're walking upstairs? You know, they'll say, no. Do you want to take it when you're bike riding? Oh, no, I don't want. Well, okay, do you want to take it when you're lifting packages? No. Okay, and then you can see they're getting this panic look in their eye. I said, well, why? Well, it'd be higher, doc. Oh, so what you're telling me is that the blood pressure is going to go up and down depending on your need. Yeah, okay, cool. I'm good with that. Okay, but also, what if the blood's not healthy? What if you had a society that's full of toxic, nutrient deficient foods? And then we develop a poisoning condition called type 2 diabetes, which actually is curable in about 30 days. Okay, if you watch the video or simply raw, it's very, very simple, and we utilize this all the time to correct type 2 diabetes, which is a poisoning, it's not a disease. But when we look at this, blood pressure does go up and down. What regulates it? We have this automatic nervous system called the autonomics. And it's very, very clear that the body is going to view the world, okay, and adjust its physiology based on its perception. Ah! Did I just change your perception? I just wanted to stimulate the fight or flight for a second, okay? Now that's just an emotional response. I hope I didn't scare you. This guy was really scared. So we got these two nervous systems. Okay, one's called the sympathetic. It's the fight or flight response. The other's the parasympathetic, the rest, digest, and repair. So we've got these two systems that have to be balanced. One's up, the other's down. One's down, the other's up. Now the fight or flight system, under physical, chemical, or emotional stress, this baby kicks in. And so what's it going to do? It's going to elevate heart rate. It's going to elevate blood pressure. It's going to elevate cholesterol. Why? Because we need the stress hormones. And we need cortisol. We're preparing for battle in this one. Okay, so the blood gets thicker under chronic stress. I mean, it's absolutely brilliant. Now, we don't want blood going to digestion in this state. So blood goes from the digestive organs out to the arms and legs so that we can run away from danger. I mean, brilliant. Your liver starts breaking glycogen down to glucose so that you have more available energy so you can run away. So right here in chronic stress, if you look at this in detail, this is type 2 diabetes, high blood pressure, and elevations in cholesterol, and gastrointestinal disorders, irritable bowel, ulcerative colitis, all of these things from chronic sympathetic stimulus. This just makes sense. The doctor of the future won't say, well, gee, I've got these new guidelines, but I also have these guidelines, and we have these guidelines that we did 5 years earlier. No, that's stupid. Okay, what they're going to look at is say, my gosh, you know what you're demonstrating here? You're demonstrating a chronic stress state. I'm not going to use these guidelines. Your body's responding intelligently to this. It's brilliant. So we're not going to give you a chemical to change this. We're going to find the physical, chemical, and emotional stressors. Go on and say, wow, the doctor of the future is cool. He's not going to do this. So what we do here, we'll actually do what's called a heart rate variability analysis. Now these are 3 different results. It's really, really hard to see, but the one, we've got 2 sides here. One's sympathetic, one's parasympathetic. So this right here is sympathetic. This is the parasympathetic, should be balanced. Everyone should be in the green zone. This is sympathetic dominant, normal, and low functioning parasympathetic dominant. So that's dangerous. To be in the chronic fight or flight state, what do you think the people on the left, the sympathetic dominant, what do you think they're going to be having? Do you think they're going to have normal blood pressure or high blood pressure? Is that a pathology or is that normal for that state? It's normal for that state. That's not pathology. Here's the psychosis. We already know that if the doctor is smarter than your body and you're in a sympathetic dominant state and you take the beta blocker, ACE inhibitor, or diuretic, what happens to you? You die earlier. Why? Because you require higher blood pressure because your body's in a stressed state. See, that's the doctor of the future. They're not going to do these ridiculous guidelines. They're going to check how your body's adapting. So what is this? You know, when we look at this in the annual update for intensive care and emergency medicine, there's real doctors out there that aren't practicing cookie cutter. They're actually real doctors looking at this. And these guys say, look, regardless of the etiology, it doesn't matter the disease. Okay, it turns out that sepsis, trauma, major surgery either cause or perhaps consequences of profound alterations in the autonomic nervous system. My gosh, they're saying that this is not the cause of disease, but it's a cause of a chronic adaptive physiology, okay, that can develop into pathology. Wow. So they're saying that disease doesn't really exist, that it's really an adaptive physiologic response to the environment. I like this. This makes sense. You know, it's not as easy as just drugging the heck out of people and just, you know, giving them more drugs for drugs that we gave them for the drugs that we gave them, which seems to work really well now unless you're, you know, talking to Lucian Leap, who says that medical care is the 3rd leading cause of death. So let's look at this, and we're going to look really quickly at the physical, chemical, and emotional stress. Because the weird thing is your body responds the same way to all 3 of these. Your body is going to respond to emotional, physical, or chemical stress the same way the sympathetics are going to fire up. So when we look at this, what happens under physical, chemical, and emotional stress? I just triggered an emotional stress response. The adrenal glands kicked up, and this is going to keep you alive. So you get an elevated heart rate, you get increased blood flow to the muscles, you get an elevation of pulse rate and blood pressure, you get oxygen sent to the brain, breathing rate increases, sight, hearing, senses. I mean, this is why they give, you know, those things for asthma inhalers. Why? Because it's a sympathetic stimulus. It's a bronchodilator. I mean, brilliant. Okay. So then you get the cortisol. What do you make out of cortisol? What's the raw material you need for cortisol? Say cholesterol. Oh, cholesterol. Oh, okay. So under chronic sympathetic stimulus, you're right. You need elevations in cholesterol to produce cortisol. And what do you get? Mobilizes amino acids, converts amino acids to glucose, increases glycogen breakdown from the liver. I mean, inflammation, allergies, resistance to stress, helps maintain blood volume and blood pressure. Here's the challenge. When we look at this, half of us are in moderate stress, 1 in 4 are in extreme stress. So our bodies are already in a sympathetic dominant state. Is that why these little rats, that are running around saying, oh my God, your blood pressure should be this, no, it should be this. No, that committee's wrong, it should be here. Why don't they respect the body? How many doctors say, look, man, your body's brilliant. It's built by God. You're adapting to this environment. You're supposed to live on this planet. You know, let's have a little more respect. Chronic cortisol. What does this look like? Okay, chronic stress, chronic cortisol, increased blood sugar levels. Could that be type 2 diabetes? What about decreased protein synthesis, muscle wasting, osteoporosis, skin regeneration problems? I mean, all of this stuff, you could see the body breaking down after stress. Let's look at some chemical stressors. Vaccinations, medications, environmental toxins, GMO foods, nutritional deficiencies, and chemical food additives. This is what our environment is exposed to. Now look at this and say, well, wait a second. If we respond the same to physical, chemical, emotional stress, and these are all chemical stressors that our population's exposed to, does that mean our population is exposed to chronic stress and our body's going to respond in a sympathetic dominant state? Could that be why I'm getting 7 and 8-year-olds with Crohn's disease? Well, I don't know. Have you ever seen an animal experimentation like this? By 18 years old, 69 doses of 16 different vaccines, and in California it's forced on the population. There's still medical exemptions, but they're very challenging to get. Now, in this front row here, there's 10 people, okay? If we gave every 10 of these people one drug, are we going to have the exact same effect? If we gave them 69 doses of 16 different vaccines, okay, over 18 years, are we going to have the exact same effect in each person? Because some people are going to get sick, some people are going to be okay, some people are going to have a great effect, some people are going to have a little effect. Forget that. Everybody, every child's going to get this stuff. Now, hepatitis B at birth within 12 hours. We're not talking about the Pitocin that they give the moms that increases vaccine damage 60%. We're not going to talk about that. It's got to be based in science. Not if you look at the Journal of Human and Experimental Toxicology. They say studies have not been conducted to determine the safety or efficacy of administering multiple vaccine doses in a variety of combinations as recommended by CDC guidelines. So if the doctor there, you bring in this cute little baby that's probably born perfect because God does good work, okay, and I've seen parents, I mean, they do good work too. You know, you guys probably all had a hand in building one. Okay, so you bring this perfect little kid, and the doctor says, yeah, you know, it's time for their 4-month shot. It's time for their 6-month shot. It's time for their 8-month shot. Well, doc, is that really based in science? Well, no, not if you read the Human Toxicology and Experimental Journal. It says studies that really haven't been done. But, you know, we test each little individual vaccine, and we think, yeah, they're going to be okay in a combination. Turns out that a positive correlation between hospital rates and the number of vaccines doses, a negative correlation between hospital rates and aged increased mortality associated with 5 to 8 vaccines relative to 1 to 4 vaccines. Let me explain that in English. The younger and smaller and more vaccines you give, the more toxic effect than the older and less vaccines you give. Okay, let's just look at hepatitis B. Why? Because it's a disease of drug addicts and IV users and sexually active people. We're giving it to kids at 12 hours old, so they're not really at risk. Journal of Epidemiology, increased liver problems, 294%. Journal of Hepatogastroenterology, hepatitis, gastrointestinal disease, and liver function test abnormalities. Journal of Microbiology, alters gene expression. Journal of Toxicology, 3 times more likely to develop autism. This is one of the 69 doses of 16 different vaccines. That's not based in science. That's criminal. Hepatitis B vaccine, Journal of Apoptosis, loss of mitochondrial integrity, apoptosis, and cell death. Do you know how many mitochondrial are in cardiac muscle? I mean, a tremendous amount. And this one vaccine, okay, that you get at 12 hours old, and you get more of them too, can that negatively affect cardiac function? Yes or yes? I mean, what's that going to do? How's the body going to adapt? Well, if it has to adapt by elevating blood pressure, we're going to shut that adaptation down by giving a diuretic. And most vaccines contain aluminum. What does aluminum do? You know, you're talking alters DNA, damages cell membranes, coagulates proteins, increases vascular endothelial adhesiveness, resulting in increased cardiovascular disease. Increased cardiovascular disease. What was that first slide? Oh, cardiovascular disease is one of the leading global causes of death. Glyphosates. Now, this is the greatest herbicide ever developed. In fact, we're able to develop plants that can withstand this herbicide, and it's designed to kill weeds so that when we get in there, we can harvest all the plants and not have to worry about weeds. What's that? You've heard about the super weeds created by glyphosates that's destroying harvesters? Sorry, there's one in every crowd. You know, any more of that, Missy, you're out of here. Okay, glyphosates. Yes, it's in our water system now. In fact, if you get any non-organic bread, they found this out. This is totally cool. If you got a wheat farm, you spray this weed killer on all the wheat, okay, and the wheat dies and it gives up more glyphosate, or it gives up more wheat. You can increase production for every wheat field about 20% by soaking it with glyphosates. Bummer, it's a mineral chelator, it's a natural antibiotic, it can destroy the normal gut flora. It's linked to depression, autism, multiple sclerosis, Alzheimer's, Parkinson's, cancer, gastrointestinal disease, cardiovascular disease, birth defects, skeletal and brain malformations, DNA damage, neurotoxicity. Reproductivity is a bummer, okay? Infertility and allergies. You know what they have now? They actually have peanut-free days at the ballpark. We were on a plane and they said, I'm sorry, we can't serve peanuts because somebody on this plane has a peanut allergy. Look at allergies. I mean, they were almost non-existent before 1900. It's mind-boggling. Toxic sweeteners. We're not going to hit the blue packet, the yellow packet, or anything else. We're just going to hit high fructose corn syrup. And I'm not even talking about genetically modified high fructose corn syrup. Okay, just regular. This is the #1 source of calories for all Americans. 2 beverages a week, increased risk factors for cardiovascular disease, more heart disease, okay? And this is approved by the Fraud and Deception Association. Wait, I'm sorry. The Food and Drug okay, anybody know what the Food and Drug Administration started off with? They were the chemistry board. Okay, they were the liaison from the chemical companies that were building these products that were going in the food system, and they were designed to make sure that everything that the chemical companies are doing is safe. So it's just fine still. Medications. Okay, let's just look at aspirin and non-steroidal anti-inflammatories. We're not going to look at the beta blockers, ACE inhibitors, diuretics, antacids, omeprazole, the proton pump inhibitors that actually increase esophageal cancers. We're not going to look at those, just aspirin and nonsteroidals. 70 million prescription, 30 billion doses are just in the United States. What do you get when you take the Advil, Motrin, Aleve, okay, ibuprofen? Well, you get a 60%, 40 to 60% increase of cardiovascular problems, hearing loss, GI bleeding, GI complications, congenital heart failure, allergic reactions, miscarriage, and 76% increased risk of atrial fibrillation. Do you know how many people, oh, and by the way, what's it prescribed for? Joint pain. What does it do? Okay, it decreases proteoglycan production, which is the building block of joint cartilage, so it destroys joints. How can you do this? It doesn't make any sense. I mean, when we're talking about patient outcomes, by God, it can't do it. Let's look at physical stressors. I mean, when you think of physical stressors, you think of this stuff, right? Slips, falls, things like that. This is a physical stress. Inactivity, lack of movement. If we understand that the brain has a plasticity and it gets its charge from the normal position of motion, these guys are developing brain damage doing this. Sedentariness is associated with several cardiovascular risk factors and may be responsible for the increasing prevalence of obesity and diabetes. Low-grade chronic inflammation is a big cardiovascular risk factor. TV viewing was associated with increased risk of all-cause mortality and cardiovascular disease mortality. What about emotional stress? What type of things are we not dealing with? I honestly, this was about 15, 16 years ago. Had this 16-year-old kid who came in with migraines. She was living with her aunt. And I said, well, what medications are you taking? She said, oh, taking antidepressants. Why are you taking antidepressants? Well, my mom and dad were killed in a car wreck. Honey, that's not a medical condition, that's life. You're supposed to be depressed. This is called bereavement, it's grief. Okay, let's help you out of the headaches. Bring your aunt in here, let's talk to her. Yeah. Neglect, mental abuse, sexual abuse, child problems, menopause, financial difficulties. Remember, physical, chemical, and emotional stress. What response do we have? So when you're looking at this list, does the sympathetic nervous system kick in? Yes or yes? It does. Let's make it really clear. So anytime you have a perception of danger, your body is going to respond correctly, not incorrectly. So if somebody comes up to me and says, how do I lower my blood pressure? What herb should I take to lower my blood pressure? And I scream, can you understand that? Okay, no, your body's responding correctly. Okay, emotions can affect your health. Why? Resulting from heightened sympathetic overload. Exactly, all of those emotions initiate that. So when we put this up at the end of every talk, we talk about nerve supply, exercise, nutrition, sufficient rest, and prayer and meditation. Those are the 5 keys. If you're missing any one of them, you're not going to be healthy. Why? Nervous system, here it is, stress kills. This person on the left, okay, is the same one on the right, but look at this, massive, massive rotation. And this is literally the off button in the body. We talked about this last week, but everybody knows that the heart is on the left-hand side of the diaphragm. You irritate this, it refers to the left trap. So heart attacks, left jaw, left shoulder pain, that's part of the differential diagnosis that everybody gets. The liver is over on the right-hand side, so liver gallbladders could be right shoulder issues. Now this is the natural off button, because God was smart when he put this in here. So what happens when you see a massive rotation of the nerves that supply the heart, and we're talking right here, T1 through T4, this is the sympathetic nerve supply to the heart. When you see a massive rotation like that, think of this. This is how the body's off button is. So you've got this. You've got stress. The liver has to process those stress hormones. More and more and more stress. And this muscle increases in tone, just like drawing a bow back. Increases. So job stress, work stress, spouse stress, boss stress. Quiet over there. Now, I'm not that bad, am I? Okay, so it draws it back. So eventually, the body has had so much stress that, bam, it fires a sympathetic charge down to the heart, putting the heart in ventricular fibrillation. So when we see something like this, we can say, my God, you've had a tremendous amount of stress. Yeah, that's why I have reflux. That's why I'm taking the omeprazole. That's why I'm taking the sleep medication. That's why I'm taking the Honest, this is the dark ages of medicine. This gal, heart attack waiting to happen. Low functioning parasympathetic, loss of curve in the neck. I mean, this is dangerous. But these are the physical stressors that we identify on the nervous system. We're looking at before and after here. You're talking, obviously, look at this different. 5 medications, 2 high blood pressure. Was he sympathetic dominant? Yes or yes? How was his sleep patterns? It was horrible, horrible. But these are not diseases. It's not a disease, it's an adaptive response to stress. Look, before and after. Medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. Now, this was old-time chiropractic philosophy. Wouldn't it be cool if we had the entire medical system up here, and instead of chiropractic, we put wellness care, health care, okay, is making sure that your body is healthy, that you can adapt to this physical, chemical, and emotional stressors in a healthy response. Exercise. I love this. Considering physical activity as a natural programmed state, and it's assumed that it possesses atheroprotective properties, that protects your arteries, okay, prevents plaque development, and induce regression of coronary stenosis. If somebody says, oh, I was diagnosed with coronary stenosis, my arteries are getting smaller, and we say, look, let's get you on 30 days of juicing, blending, and walking a half hour a day, and we'll reverse the stenosis. Can I show you a dozen articles that show the stents they put in there cause damage? No, it's crazy. Exercise increases angiogenesis, that's blood vessel formation, neurogenesis, synaptogenesis, neurotransmitters. And all it is, the best walking ever is walking barefoot. I mean, it just makes sense. Grounding appears to be one of the simplest and yet most profound interventions for helping reduce cardiovascular risk factors and cardiovascular events. Inflammation is how the body heals. Okay? Except inflammation is the oxidative process. Okay, you break down tissue and you're going to break down 1 billion cells a day. You're going to build 1 billion cells a day. That process is called oxidative metabolism. In that breakdown process, you produce free radicals. Free radicals can damage healthy tissue. So you take antioxidants that deactivate those free radicals. In psycho world, you'll take a non-steroidal anti-inflammatory, which we know the damage those do because they stop the healing process. But in normal world, the anti-inflammatory will be omega-3s, fresh fruit, things that have extra electrons to deactivate those free radicals. Does that make sense? Turns out you got skin on Earth, you're creating antioxidants. God was smart, man. I hate because I think he did mess up on the pit in the avocado, but you know, everything else he did really good. No, I mean, Moses argued with the bush. Honestly, when I see the man, I'm going to say, hey, look, you know. Okay, further evidence. Higher consumption of fruit and vegetables. No, it can't be this easy. Lower risk of all-cause mortality, particularly cardiovascular risk factors. Gee, doc, I've got high blood pressure. Okay, we're going to fix the sleep patterns, we're going to get your nervous system checked, and you're going to eat a bowl of fresh fruit every day. Okay. Yes? Yes. Good. You might have thought that was directed at you because I pointed at you. Yes? I love you, dear. Everybody does. We got to keep you healthy. Garlic may provide an ideal alternative to aspirin in atherosclerosis prevention. Okay, really, an aspirin a day. Okay, I wish I could show you the study on that one. I forgot. But you're talking, it's the leading cause of kidney disease. It's the 4th deadliest drug in America. It increases your body risk of stroke. That's aspirin. Garlic tastes good. Yeah. All fruits, berries have shown substantial cardioprotective benefits due to their high propafenol content. Blueberries, amazing. Okay, Journal of Nutrition. Almonds. Now, they actually have doctors saying, for God's sake, stay away from nuts. Okay, it is bad if you're doing almond butter with almond milk, with almond bread, I mean, that's going to be a polyunsaturated fat hell because polyunsaturated fats tend to stick blood cells together. Also, low stomach acid. So if you're taking antacids, proton pump inhibitors, or have high stress, you're going to produce less acid so the blood cells stick together. Blood doesn't clot in the arteries, blood clumps in the arteries. Okay, so we have to look at the factors. However, the Journal of Circulation turns out that almonds, and I'm just talking a normal amount, significantly reduce coronary heart disease factors. Higher nut consumption may reduce the risk of coronary heart disease. Higher nut intake associated with reduced risk of cardiovascular disease, total cancer, overall mortality, and mortality from respiratory disease, diabetes, and infections. Isn't that cool that we're now starting to see data that these are not really diseases, that they can be corrected with nutritional approaches? Nuts, lower risk of all cardiovascular disease, inverse associated with IHD, overall cardiovascular disease, and all-cause mortality. Sleep, lack of sleep, cardiovascular disease, diabetes, cancer. How many people here get deep sleep every night and wake up refreshed? I know. I see a Starbucks on every corner. Okay, we've done 4 talks on sleep. It takes 5 days to get deep sleep. Okay, you got to reset your circadian rhythms. And this works 100 times out of 100. Okay, check out our sleep video, but understand that lack of sleep, wait a second, lack of sleep, would that cause a relaxing effect or put you in stress? Stress. Okay, so lack of sleep, what would that do to blood pressure? Increase. What would it do to cholesterol? What would it do to gastrointestinal or to blood supply to the gut? It would decrease it. What would it do to the immune system? Oh my gosh, look at this. There it is, constipation, stomach ulcers, dementia, kidney disease. It just makes sense. You know, these aren't diseases. They're an adaptive physiologic response to treat the diseases like it is something attacking the body with a chemical that second guesses their physiology is psychotic. Prayer and meditation, what a great idea. Daily, I mean, and here's a couple of things that you can do. Daily prayer and meditation, phenomenal. Connecting with a higher power, you know, makes sense. If not, just repetitive motion helps. Emotional freedom technique is amazing. Neurolinguistic programming, the Demartini Method. This is one of the ones we actually have on our website, the Emotional Freedom Zone. Okay, and our practitioner, Carolina, she's right there. Yeah, if you want to say hi to her later, you can. Or go on, you know, drjohnbergman.com and check out our Emotional Freedom Zone. It's cool because it's a method that breaks down emotional ties to certain events. Because if you haven't dealt with an emotional event effectively, it's really going to run your life. What do you think a traumatic emotional event's going to do to blood pressure? It has to. It has to, because that's an intelligent response. So check out our site. We've got new video courses that we're building. Okay, we're talking on blood pressure. We've got new video courses on our cruise. We've got articles. Sign up for our weekly newsletter, and we've got some stuff coming out on school violence, or the violent episodes that are happening around, how that's linked to gut function and certain medications. Okay, check out, sign up for our newsletter, because we've got some articles coming out that are out of this world. Yeah, over 30 video courses. Yeah, I'm not going to have a day off until the end of December. We're filming now 7 days a week. Okay, so you're going to like it. It's really cool. Okay, I mean, it's because, I mean, when you talk about this, there's a big paradigm shift of thought. I mean, if you thought that you're taking this diuretic because your doctor says you, I'm telling you right now, sick people need drugs. It's not keeping you healthy. Okay? Your body can be healthy because it's designed to be healthy. Yeah, so I mean, it's going to be fun. Now, any questions? And this, we can even take 2 questions from the live feed. Any questions? Yes, ma'am.
I have a friend, he had put the stents in. And now they have told him that he has more of those little arteries that are not good. And he's scared. I mean, there is something like a heart attack, right? Because it's too tight.
No.
So what should that?
Okay, well, when you look at heart attacks, and this, they went back in the 70s, heart attacks come from neurologic problems. 80% of all people that had heart attacks have not enough arteries to keep them, to clog them up. So you can clean the arteries very, very quickly. We're talking within 30 days. Have them look at ravediet.com and ravediet.com. And that's a really good one, where they had a couple of doctors. One 90% occluded, the other one 85% occluded. Within 90 days, bam, they're all clean. And so when we're talking about this, I just brought up an article. Exercise and juicing fruits, you know, it changes. So that plaquing is not cholesterol clogging the arteries. It's a protective mechanism of the body trying to heal up damaged arterial tissue. So it's a toxic deficient lifestyle. The way they find it, they use angiograms, and angiograms are completely inaccurate. Okay, it's the gold standard. And next week we're going to talk about cholesterol. The week after that, we're going to talk about interventions. And when you see the part on angiograms, you're going to be blown away. The inter-examiner reliability is just virtually non-existent. It's like less than a third. So it's not accurate. Placing the stent is completely ridiculous, and you're placing it in living tissue. It does not prevent. The reason they came up with stents is because the balloons didn't work. The reason they came up with balloon angioplasty and then stents is because the bypass surgery was so dangerous, okay, and it didn't work. People ended up dying early from bypass, so you had to come up with something else. And the entire infrastructure of the cardiac wards is so huge in the money-making industry, okay, that you're not going to go in there and say, look, man, we're going to clean your arteries in 90 days by doing juicing and blending and getting your nervous system working right. Yeah, what he's got to do, get his nervous system checked, and this is going to clean his arteries. He's got to get deep sleep, get the juicing and blending, exercise. He's got to, you know, really watch it, and he'll be healthy. Yes, sir.
Can you go a little bit about people who do their berries and fruits every day, juicing, buying organic versus buying the non-organic?
Oh,
cheaper.
Oh, okay. So he asked about what about buying organic versus non-organic? Okay, if you're eating the skin, you got to buy organic. Okay, if you're not eating the skin, you know, it's a risk. Okay, but it is expensive. But look at frozen berries. Frozen organic berries you can get at a pretty reasonable cost. They maintain most of their antioxidants, and it's really easy to just grab a scoop and put it in there. Okay, but it's worth the effort. I mean, you know, I don't know. You know, it depends. Is the person really worth I mean, are they nice? You know? If they're nice and you want them around, yeah, feed them organic. If not, you know, give them the stuff that you would throw away. No, what you eat becomes you. My gosh, they pray over food, you know, because it's going to become in you.
How do you feel about meat then?
How do I feel about meat? Look at the blue zones.
Yeah, I know.
Okay, and blue zones, if you're eating animal products once a week to once a month, but it's got to be a healthy animal. Okay, you can't be eating commercially produced animals like halal, kosher, okay, antibiotic-free, hormone-free, normal. Okay, but not every day. I mean, I had a big mind meld, okay, because, I mean, some cultures you're going to eat meat for breakfast, meat for lunch, meat for dinner, and then meat snack, and then you got the meat drink for the evening. But I was able to talk to my Pakistani wife into eating plant-based food, which wasn't easy. Really wasn't easy. Yes, sir.
Yeah, how does the JNC justify these changes in ideal blood pressures?
Oh, how does the JNC justify the changes in blood pressure? They keep rethinking it. And if you check out our video on what's a normal blood pressure number, I think that's what we titled it. I go into details on it, and they don't. It's not based in science. It's just random gambling. You know, that they'll say this is what it is. I mean, if you look at Joint National Committee 7, everyone should have 115/75, and for every 20 millimeters of mercury, your risk of cardiovascular disease increases 20%. And you know, and it's like, holy moly, that sounds really good. They use a lot of numbers and percentages. These guys must have really studied this. Okay, then 10 years later, you're finding out that, man, you're slowing the heart down. You're decreasing oxygen in these stressed individuals, and you're lowering it to a completely insane random number that they had to elevate it. Okay, but that was so absurd in certain doctors' dogmatic approach to this that they said, well, no, we can't go along with it. We're going to make our own guidelines because our guidelines are more evidence-based than your guidelines. Nobody's looking at the physical, chemical, or emotional stressors and appreciating that the body's intelligent. I mean, 100 years from now, they're going to be looking back at this time as, really? You had no respect for the body? Yes, ma'am.
What if you have low blood pressure?
Oh, what if you have low blood pressure? Okay, what's wrong?
I don't know.
I don't know either. Okay. What about hypovolumic? What about your arm not being sturdy or muscular? Maybe they're putting too much pressure on it. Maybe because, you know, when you're talking about this, athletes typically are misdiagnosed with high blood pressure. Okay, what's broken in your body? Say nothing, because nothing is. They're looking at you in comparison to a chart that's random. What I would do, not checking low blood pressure, I would look at the pulse pressure. The difference between the high number and the low number should be about 40. So 160/120, that's in the ballpark, that's 40. Okay, 120/70 is dangerous. Okay, because the bigger pulse pressure, the bigger difference between systolic and diastolic means that the body is working really hard, so the blood's not efficient. It's not a red flag, but it's a clue that your body is dehydrated or nutrient deficient. If you get something closer or less pulse pressure than 40, like let's say 120/100, that's a body in stress. So what do you take to lower the blood pressure? Say you don't, you just correct the stress. Please, I'm going to throw my computer at you if you don't say that. What's excellent, excellent, good. Yeah, because your body's responding correctly. Yes, miss.
What are your thoughts on blood thinners for valve replacement?
What are my thoughts on blood thinners for a what?
Valve replacement?
Valve replacement. Excellent. There is a really cool blood thinner out there. It's a mixture of two gases, hydrogen and oxygen. It's absolutely phenomenal. And it's the same answer, not for just valve replacements, okay? But what about cardiac arrhythmias? They're going to do that, okay? And then if you look at the statistics, okay, like let's say cardiac arrhythmias, okay, because that's one that I'm familiar with. If you do take a blood thinner and you got cardiac arrhythmias, you got a 97% chance of never having a stroke. course, if you don't take blood thinners, you have a 94% chance of never having a stroke. That's a difference of how much? No, it's a 100% difference, because we're going to manipulate the numbers into making people think that you actually need it. Okay, what type of things can you take that would make the blood healthy? Because it's not that when it hits the valve, there's a turbulence, and the blood vessels are so unhealthy that as soon as that turbulence or interruption of flow, that they stick together. Can you see the psychosis there? Okay, to have a valve replacement, this person's had a long-term toxic deficient diet. And if they're in a chronic state of stress, that's what caused the valve replacement in the first place. And that means low stomach acid. Low stomach acid, those blood cells get sticky. Toxic deficient diet, they're taking corn oil, soy, canola. Okay, what about vitamin C? Is that a good thinner? What about omega-3s? Phenomenal. Omega-3s, my God, that's a blood thinner, but not a blood thinner. It makes blood healthy. And that's actually a nutrient that's going to be good for the brain. Whoa, this opens up a whole new world. What about juicing and blending, which gives soluble fibers, which is going to clean the blood? So this means everybody with a valve replacement's got to do juicing and blending at least a half a quart a day. So this way their blood is clean with those soluble fibers. By gosh, the diverticulitis is going to go away. Everything's going to go away. They're going to be healthy. That's a good idea. I like that. You're onto something. Yes, ma'am.
In terms of potassium, aren't bananas like number 90 something on the list of?
Yeah, but people don't study nutrition. Potassium, yeah, I'm going to get a banana, you know. It's like vitamin C, I'm going to get, how many people would say bell pepper? It has 4 times the amount of vitamin C than an orange. Why not? Yeah. No, it's just good. God put the stuff here for us. Yeah, let's party. Or, you know, whoever put it here. Okay, next week. Any questions online?
I think one says, Dr. Bergman, how do you get someone off blood pressure meds safely? Do you slowly take them off the drugs or while working with their health, or do you slowly reduce the dosage?
Okay, how do you get someone off of blood pressure drugs?
And cholesterol drugs.
And cholesterol drugs, okay? Do you slowly wean them off, or what do you do? This is the fun part. Okay, what you do, okay, and this is what I tell everyone, the person that prescribed the drug has to be the one to take you off. That's what you're supposed to do. But then hopefully I'm dealing with human beings here, okay? Human beings are sentient beings that have common sense. So what we'll tell them, we got to find, what was the cause of the high blood pressure? Say physical, chemical, or emotional stress. Oh, okay, so we should address the cause. That's such a good idea. Okay, so once you've identified the physical, chemical, and emotional stress, so you've done the x-rays, the neurologic exam, you've asked them about their sleep patterns, how many bowel movements a day they get, you do a really good exam, okay? Then you say, check your blood pressure, okay? And what do? You put your arm level with your heart and you deep breathe for 10 minutes. And what do I have to do? I have to tell people how to deep breathe. When you breathe in, the diaphragm comes down and the stomach should come out. When you breathe out, your diaphragm comes in and your air comes out. You know how people breathe? Okay, the stomach goes in. Why? Because nobody wants to show off their beautiful tummy. And they want to show how big a chest they got. Okay, when real breathing, that's diaphragmatic breathing. You got to reteach them how to breathe. So I teach them how to breathe. Okay, I sit there and I say, put your hand here. I'm going to punch in the stomach. Now, blow out, blow out. Now breathe in and push up. Okay, so I do this about 5 times. Okay, and I can tell them, I said, look, if you want to not do this, okay, get a machine called Respirate. It costs $350. You listen to this tune, causes you to deep breathe for 15 minutes, and it's better than 2 blood pressure medications. That's what it says on the label, and it's FDA approved. Or sit down with your arm level with your heart, deep breathe for 10 minutes. Then you're going to check it. Then what do? You call up the doctor. Doctor, I'm taking an ACE inhibitor, diuretic, and a beta blocker. Yeah, you know me, buddy. Okay, I just did some lifestyle changes. You don't say that I went to the chiropractor and got my physical, chemical, and emotional stress laid, because they won't get that, because they're not nerve doctors. Okay, they haven't a clue at the physiology, otherwise they wouldn't have prescribed the shit in the first place. So you call up and you say, Doc, I've been checking my blood pressure and it turns out it's low. Okay, well, according to science, blood pressure is the silent killer. So you may reduce the diuretic in half. Okay, why? Because the diuretic causes ventricular fibrillation from loss of potassium, so that's the most dangerous one. Okay, then you call them up the next week, Doc, my blood pressure's still low, because it's an objective analysis. It's an objective analysis, it's an object. So then what happens? The second week, okay, you can stop the diuretic, but keep monitoring that, because blood pressure is the silent, yeah, I know, silent killer, I know, you told me last week. Okay, so what happens next week? Okay, Doc, yeah, there's me again. Yeah, checking my blood pressure, it's still too low. Okay, the beta blocker, what, cut in half? Okay, are you doing this by any science? What science are you using here? Oh, you're just guessing. Oh, okay, what if I just stop it completely? Well, blood pressure is the silent, yeah, I know, silent killer. Okay, yeah, okay, I'll give you a call next week. Okay, people will do this for about 3 to 4 weeks, and then they start to take charge of their own health. But the doctor that prescribed it is supposed to be the doctor that gets you off. So monitor it. It's an objective analysis. It's the easiest thing in the world to do. If it's too low, you're taking drugs that you shouldn't take. Okay? And cholesterol drugs, you just got to get educated on. My gosh, next week we're going to have a ton of education on it. But knowing that it increases heart failure, and it increases hardening of the arteries, and it's 70% of your brain, and all the trials show that cancer rates increase if you're taking a cholesterol-lowering drug. The only benefit is profit. It was the first drug that crossed the $10 billion mark. And they convinced you that there's bad cholesterol and good cholesterol. That's a psychosis. Yeah, education. Okay, next week, cholesterol. Thank you very much.